The technologies of telehealth are advancing quickly as part of the connected care revolution. From remote viewing of medical scans through to patient video conferencing. Yet access to telehealth not only depends on telehealth technology. Policy frameworks must be modernized. Communications infrastructures like broadband and mobile must be improved. And skill sets, both of clinicians and patients, need to be strengthened. In 2015, 43 US states introduced more than 200 telehealth-related items of legislation. The country is a world leader in its pursuit of portable telehealth licenses, allowing providers to operate across state borders. Telehealth in the EU, on the other hand, is regulated largely by individual member states. But the European Commission plays a harmonizing role. A common challenge is making sure everyone has access to the communications technologies that telehealth depends on. In Bulgaria and Romania, around 40% of households do not have internet access. Some countries are investing heavily to deal with unequal ICT access. The Australian government has funded pilot programs to make health services more accessible in remote areas. Canada has poured $2.1 billion into more than 400 projects since 2001. How does the Gulf Cooperation Council compare? The region faces a major chronic disease challenge, and total healthcare spending is forecast to reach $60 billion by 2025. Gulf countries are increasingly integrated, which could help harmonization efforts in telehealth. GCC trade has increased sevenfold since 2000. A regional rail network is underway, and a power grid allows countries to share electricity. Member countries are exploring health smart cards and a centralized drug registration system. The GCC has superior ICT infrastructure compared to their neighbors in the Middle East, providing the foundations for effective telehealth services. The UAE ranked 23rd globally in the World Economic Forum's Network Readiness Index. Qatar and Saudi Arabia were ranked 27th and 35th, respectively. Saudi Arabia has allocated a huge budget for e-health and is the fastest-growing health IT market in the Middle East. And Qatar launched its national e-health strategy in June. Key challenges include regional equity in ICT access. There are still broadband blind spots, and some of the population, especially the elderly and the disabled, may not use the internet. A second challenge is adoption. A survey in Saudi Arabia found that interest in telehealth was high, but adoption was low, as some tools were difficult to use. In the Gulf, as elsewhere, ensuring access to telehealth depends not just on technologies, but on the broader enabling environment, especially communications infrastructure, policy, and skills training.